सब ठीक। हाँ बताओ, सब ठीक।
ठीक ठीक। Okay, so please take a focus history of 12-year-old child, okay, who
Okay.
has came to you in OPD clinic for a review because his mother is worried as he had episode of seizure 2 days ago.
Okay.
Sandeep, time fix करोगे?
Yeah, I'll do the timing. 14 plus
Okay.
9.
Okay, name I should call mother as a Fatima and the child name Ahmed. Is it okay?
Yeah, perfect.
Mhm. Should we start?
Yes.
Good afternoon.
Good afternoon, doctor.
I am here, doctor, pediatric doctor. I believe I am speaking to Fatima, mother of Ahmed.
Yes, doctor. I am Fatma.
How are you?
I am fine, doctor, but I am quite worried. This Ahmad is not doing good. Day before yesterday, he got fits, and really, now I am quite worried why he is having fits again.
Okay, thank you for coming, and I am really sorry to hear this. In fact, I have also received a letter which is showing this episode of this fits which occurred 2 days before. So, can I ask some question, and I will make note of it. So, is it okay?
Yeah, sure, doctor. Yes.
Okay. Can you, mom, tell me when this 2 days before when it occurred, when this fit happened?
This fits happened 2 days ago when he was in the school.
Okay. So, did anyone witness? Did anyone see?
Yes,
Any?
his friend. He informed to class teacher, and the class teacher called uh, his father in the hospital that he has got a fit episode. His father actually he went to hospital to show for his health, and meanwhile he got such a news. So I am really worried now.
Okay, I understand. In fact, it is a worrisome situation, but I am here to support you. But can you tell me the Ahmed was well 2 days before? Any fever or anything, vomiting? 2 days before, how he was?
Yes, 2 days ago Ahmed was fine. There was no issue. That's why he went to school. Everything was fine.
Okay. So how long it lasted? Father went or anything? Their teacher or students which were the witness? How long the duration of the?
Yeah, duration it lasted for 2 to 3 minutes, and then it stopped.
Okay. And apart from anything, it was actually it is an one-sided or whole side body involved.
It was like whole body.
Okay. Apart from whole, anything uprolling of these eyes or drooling of the saliva, any eye deviation to one side.
Yes, his teacher told me that he started with the uprolling of the eyes. Also, he had some secretion in the mouth, and few jerky movement of the hands and legs also happened.
Okay. So After how long he become, after this 2 to 3 months, how long he become return to normal?
It took around after that 3 minute, 2 to 3 minute episode. He just fell asleep for, let's say, 5 minutes, and then again he was normal
Mhm.
before.
Okay. So at that time, the fit it's settled on its own, or any medicine or any spray for to stop the this seizure? It was any given, or it stopped on its own?
It's stopped on its own.
Mhm. Okay. And after that, once this fits stopped, that he was drowsy or anything, a weakness or any fatigue.
After that, only for a few minutes, he looked like a drowsy as per the his friends told us. But again, in 5 to 10 minutes, he was okay, like normal. After that, he came normally to home and like nothing.
Okay. So this is the first episode, or it happened before the same episode? Any history of similar episode in the past?
Uh, yeah, before also many times it happened, doctor. This was not the first episode. Actually,
Can
he
you
was on taking some medicine also for that. He was on this Depakin, and I don't know, this will happen maybe 10, 15 times. It is not first time, doctor.
so how much duration in between? You are saying 10, 15 times the episode. There is a past history, but in between, how long frequent in between these two episodes?
Yeah, like it was totally without seizure for before this episode, almost around 3 to 4 months, and then again it happened 2 days ago.
Okay. So when it first when at what age it was he developed, what diagnosed as epilepsy?
He was diagnosed epilepsy like after his birth. He had some fits when he was admitted in the neonatal ICU when he was small, and since then he was on the medicine. In between, doctor stopped the medicine because he became fits free, and then again it started.
Okay. How
So
long he remained? And again he started newborn period. He was admitted and he was
yeah,
start and was fits free. How long he was fits free?
yeah, he was fit free in between, let's say, for 1 year he was fit free.
Okay.
We gave medicine for 2 years after the discharge from the neonatal ICU. Then again he became fit free, and then he threw some fits attack,
Mm-hmm.
which was brought in our attention from the school.
Mm-hmm.
And then again, there's some investigations were done, and it showed like he needs a longer duration medicine.
Okay. So currently, which medicine you are
Currently,
giving?
he's on Depakin and Leviracetam.
Levetiracetam and another is
Depakin.
Depakin. Okay. How much is the dose?
Uh, I'm giving half tablet of the Depakin, and Leviracetam also. I am giving this Kepra. I am giving half tablet.
Okay. This is the how frequent you are giving per day?
Both I am giving once in a day.
Okay. Who is giving? Himself is taking, or you are giving?
Before I used to give, but now since past 6 months, he
Mm-hmm.
said, "Mama, I am now big child. I can take by my own." so you don't need to worry. So I left on him, and now he's the one who is taking this medicine.
Do you think he might be missing sometime, is skipping the dose?
Well, I'm not quite aware. He is otherwise very sincere and obedient boy. I don't
Mhm.
think so, doctor. Do you think? I mean, why do you think like this?
Because this could be sometime if the dose may be missed, so that could be the
9 minutes.
cause of the.
Okay, okay.
Mhm. Okay, so at time of this neonatal admission or first time he developed this fits, which he was started with medicine, and subsequently which medicine was given for 1 year and he was symptom free at that time, which medicine?
When he was in the neonatal ICU, the doctor started with the phenobarbital,
Mhm.
and after a few days they changed to other medicine, like they put on the phenytoin, like tablet syrup called Eptoin, and again there were few episodes of the feeds. Then they changed to this Depakine, and on Depakine also he was not good, so they put another medicine called this Keppra.
Okay. Anytime you witness any side effect, any adverse effect of any of these medicines or any drug allergy, medicine allergy of these tablets, any weight gain or anything?
Yes, yes, doctor. He has some his teeth look small aligned, and I can see a lot of gum tissue, and also I noticed sometime uh, he's eating more, and there is a weight gain also. He gained uh, at least 2-3 kg weight since they put on this Depakine.
Okay. Currently, with whom you are following? Which doctor?
Yeah, there is a brain doctor in with whom I'm in follow up currently.
Okay. So recently, any change in the drug and dose? He has adjusted any dose recently, or any medicine change, or any dose is changed?
Uh, no, but we had actually they called us for follow up, and his next appointment is after 4 days. So I think now because of this fits, we will go early.
Mhm. Okay. So, do you remember which investigations were done at this neonatal period for this diagnosis epilepsy? Which investigation? Do you have any idea?
Yes,
Do you?
yes, for yeah, they did the one test called EEG. Also, they did a lot of sonography of the brain, ultrasound was done.
Mhm. Okay.
And later on, when he became 5-year-old, they also, I remember, they did one MRI also.
Mhm. So, did doctor they told anything, something abnormal, revealed anything abnormal?
They told because of he was sick during his newborn period, and there
Mhm.
was problem with the birth, and because of that his brain got little less supply of the oxygen, and because of that
Mhm.
he's having this problem.
Okay. So he cried late.
Yes,
Uh,
he cried late, and he
mm.
was kept on the breathing machine for a few days.
Okay. He was full term born or premature were delivered.
He was a full-term doctor,
Mhm.
but he swallowed some uh, they called it meconium when he born,
Mhm.
and he was having some delay cry.
Mhm. Okay. And subsequent, how is with the development and regression of the development as other peers? He is developing naturally.
Uh, Yeah, actually, he started walking at the age of 2 year, and he started sitting at the age of 1 year. So there was delay, yes, doctor.
Mhm. Okay. And what about regarding this the immunization?
Immunization, so far, we are giving all the jabs.
Mhm.
Okay, 14 minutes. Present your case.
Oh, okay. So today, 12 years, I have taken the history. 12 years old child, Eamon. So having seizures, he developed 2 days before. He was all right, and at the age of the neonatal period, he also developed this seizure, followed by there is a history of the delayed cries, and it could be the birth asphyxia. And so now they rushed to this GP, and the child was not responding to the treatment. So and he is currently on these two medicines, this levetiracetam and this Keppra, and this two medicines twice a day. And previously he was given by his mother, but now he is taking on his own.
Okay.
Hmm.
So what do you think? What are the problems here?
He has there is a history multiple seizure, because initially he was diagnosed, then he was kept on this medicine, and in between he was okay, and he was fits free, and after 2-3 years again he developed. So he has a multiple seizures, and so it could be more of this uh, generalized epilepsy. And it is as from this history, it look like this the jerks, and maybe the generalized epilepsy.
Okay.
Hmm.
So,
And cause it could be in a view of the system, maybe the case of this cerebral palsy, because due to the brain insult, due to the hypoxia, is the underlying cause, which is responsible for these fits, seizure.
okay. Mhm. What are the other differentials you have in your mind?
So, in fact, there ideally there should be we should have to start the family history of the similar episodes, or any genetic, any metabolic disorder. So also I will put in the diagnosis differential, the any genetic abnormality, any metabolic disorder. And at this newborn period, if there may be any history of this again meningitis or any infection, there may be the history of the fever. So first, my diagnosis would be this cerebral palsy, and second one I will rule out for this any genetic, any disturbance, or any metabolic genetic cause, maybe sometime infantile spasm or any. We have to rule out accordingly.
Okay.
Mm.
All right. So, this case now, what are you going to do with this case? How are you going to manage?
Mhm. So, okay, after this complete history and clinical examination, so I will go through the drug level. That is also an important about this drug level. And I will also ensure the compliance, and I will also uh, look for any trigger. So to eliminate that any trigger may be any, so we have to uh, eliminate that one. And if the drug level is also the compliance, that is also must. If he's regularly taking, that's okay, but if the drug level is not attain that much adequately optimal level, and then we will step up the dose. And also further investigation we will rule out blood chemistry also we will do for this recent, though we was carried out in this past, but again for the recent event we will do this sugar level, blood sugar, this CBC, or maybe this any ammonia, LFT, SGPT, Sometimes the drug also may interfere with this. So, and subsequently, I will also involve my consultant as well. And in fact, it is a multidisciplinary team. And so also we're a school teacher and also the school nurse and also the nurse specialist in the epilepsy, community pediatrics, and also genetist to rule out any cause.
Okay. Okay, fine. So this mother is telling that she wants to send this child on the trip, which is coming after 2 months. So what you would advise, whether child should go for a trip, school trip?
Oh, yes, that's really a good question. But again, after observing all the precautionary measures and also this if he is taking this treatment regularly, and again we have to ask any and the altitude or anything. So in that case, we have to be careful. So under supervision, we can send.
Okay, so what you will advise under supervision means what, how you will advise the mother?
Yes, apart from his routine medicine, that should be it should taken the very regularly. And apart from that, in case of this, if he develops this again the seizure activity, then for the rescue therapy, we will suggest prescribe the midazolam nasal spray. So they should keep with them to cope up with this in case of that he develops the fever or the fits. Sorry.
Okay,
Mhm.
okay, fine.
Mhm.
Okay, so this child, see, I mean, your discussion part was very good, Dr. Jaiprakash.
Mhm.
Discussion, you came to the actually this was the real case,
Mhm.
and there was an issue with the drug level. Okay.
Mhm.
The first thing on the management you said that was a very nice, like you would like to check the compliance as well as the drug level. Sometimes even though they are taking a normal amount of the medicine, right? Regularly the child is taking, but still somehow due to the drug interaction or metabolism or XYZ reason, there is a change in the drug level. So we need to modify. So that was a very good, you gave the good cause for this. The other causes you mentioned, genetic and all, generally 12-year-old child when MRI and everything is done. So most likely even the genetic also, they just metabolic workup and all, most likely
Ruled out, yes.
assumed as a like ruled it out or already done with this child. Okay.
True.
So my impression is like you spend a lot of time in the current problem or the chief complaint,
Okay.
which is fine. You have to, everyone has to spend a lot of time into that. But there was a more long, and then you come to the like past history and the birth history, and you touch the very important, which is development and past history. But a little bit more about the NICU admission. I wanted to like I thought maybe you will ask me more about this, what happened, and how many times it happened, what was the exact problem, why he was admitted, and how long the course. Then anybody in the family has a history of the seizure,
Mhm.
any hospitalization happened because of the fits.
Mhm.
So these few questions were not asked. Allergy, okay. The immunization also, it's fine. I mean, not that much important, but milestone, good, you covered. NICU history also, you good, you asked. So overall, little bit prolonged acute history.
Okay.
Almost, I think you spend 6 minutes or like that in the acute if I'm not wrong. Yes, Sandeep?
Almost 8 minutes, like in first
Hmm.
initial problems.
Yeah.
Problem like the more time is spent because like you were asking the long questions and yourself you were answering the for the role player. Like
Hmm.
how was he after the seizure? Was he drowsy? Was he unconscious? Like let the role player speak. It will be short and like, what was how was he after the seizure? Let the role player speak. Like you were asking the question as well as answering the for the role player as well. That actually consume more time. Many such questions were there. You can listen later on. And like multiple seizure history, once the mother has said like this child has suffered seizure, so immediately after that we should ask, is this the first episode? If it is says it is first episode, then go in too much detail of the current episode, like what was the how was the child before the episode, like any fever, vomiting, any stress, traveling, or poor sleep. Then what was the episode? How was the episode? Like anybody witnessed the episode? Can you describe in detail? A short question. The role player will give more answers. Then how was he after the seizure? If you are not getting appropriate answer, then you put a close question. Like if the role player is not able to answer how was he after the seizure, then you can say was he drowsy? Did he vomit? How long he was unconscious? When did he recover? How did he recover? Like you said, like how did this seizure stop? Was there any medicine was given or on it stopped on its own? Like this is like asking the question and answering also was there, so it took more time. But if when we ask, is this the first episode? Mother said like this has happened many times before. Then we can say, can you describe a typical event? Was it a typical like before, or is it a new type of seizure? Like we have to see like whether the previous episodes were same or the previous were different, and this current one is different. Like absence seizure is there, and then they later start with the myoclonic epilepsy. That differentiation has to be done properly. Also,
Yeah.
more importantly, that mother said like child was admitted in NICU. Immediately we should ask the question: can you tell me the reasons why he was admitted? Was there any problem with the birth? And like how long he was there in the NICU? Like small questions will give you more information. Like open-ended questions will give you more information. Also, impact of the child, this disease on the family, impact of the disease on the child. These are very important. Like we should touch these things more than this, like asking for the immunization.
Yeah. How the family is coping
Like
with
any
this
chronic
problem?
history, impact of the disease on family and impact of the disease on child has to be there. Any chronic, like chronic asthma, you can say chronic allergies, you can say diabetes
Diabetes.
with follow-up. That there social has to have to have come there. Social we should not forget at all in any chronic history.
Yeah.
You can forget
Impact as well as
birth
how
history, you
he's
can
coping.
forget pregnancy history. If it is not relevant, you can forget immunization history. But allergy, social history, drug history in chronic cases are very, very important.
Yeah. Dr. Tamanna, any feedback?
Dr. Tamanna's partner is not here today.
Yes, I was going here and there at this room, that room. Okay, I listened. It was good. History taking was good, very good. Actually, I did not concentrate. And do you want to do this extended clinical now, or we can discuss after some time? I mean, not like exam, but we can discuss how we will tell.
Yeah, if you have time, we can do. But if you are busy, then we can
I'm
postpone.
not busy now. Now I'm free. Actually, I went another room. I did some work.
Yeah, yeah. Then we'll just log out and we'll log in again because only 4 minutes left. Then we will discuss this.
Yeah, yeah. We can discuss just how we will
Yeah.
do this
No, do in a real time manner. There's no point. I mean,
There's
go through the time with time.
candidate is not
That is
here.
better.
Hmm.
That is better. It may
Where is the candidate?
discussion will be the same way, but you will feel the.
Okay,
Coming back.
any one of you can become the candidate. Anyone? Okay, no problem.
Do you?
Okay, no problem. Just practice, just
Okay,
for
we'll-
practice. I am also not prepared,
I
but
will
I
be role
can.
play, you become a candidate.
Huh?
Tamanna, you become a
Okay.
candidate.
Okay, no
Okay.
problem. I can. Okay.
Okay.
We'll rejoin
Fine.
again. Okay.
Okay.
Okay.